Hi everyone, I'm going to be talking about blast-related TBI. Blast-related TBI is when the brain is negatively affected and the rest of the body by shockwave. This mainly affects combat veterans who deployed to Iraq and Afghanistan. The signs and symptoms can include ears ringing, headache, and irritability. An IED is the most common cause of blast-related TBI. These are homemade explosives, usually made out of ammonia and diesel, that can actually be linked together, and one IED can trip another, and another, and another, and that's actually called a daisy chain. There are several ways to detonate, such as pressure sensors and tripwires. So there's 4 different types of TBI. There are primary, which is a blast wave, secondary, which is fragments, tertiary, which is body displacement, and quaternary, which is burns. Secondary and tertiary are the 2 most common types, and that's due to the amount of foot patrols and military convoys that's done. So it's typically diagnosed with DTI, which is diffusion tensor imaging. This particularly looks at the movement of molecules through the brain. This is done through the changes during cognitive tasks, and unfortunately DTI is not the end-all be-all diagnosing mechanism that's used, because changes in the brain don't always happen until about 6 to 12 months out after the injury. So skeletal muscle, so muscle tears around major joints become a huge issue because the weight of the gear, which is anywhere between 75 to over 100 pounds, is worn on the body. So for example, hyperextension and flexion of the neck is one of the biggest injuries that's actually seen. And the good thing is the gear that is worn actually increases survival after the blast. And there are other injuries such as amputations and fractures. So the central nervous system pathway for information from the white matter is greatly inhibited because of TBI. Memory and mood is also inhibited because the frontal lobe is one of the first things that gets hit on a frontal blast, and it eventually radiates through the hippocampus, and these control moods and memory. So a lot of times the service member has excessive mood swings and memory loss. The temporal lobe, which mainly gets hit on a side blast, affects hearing and processing info, so a lot of time they can't hear or understand what you're saying. And the cerebellum and the reticular formation affects balance, so a lot of times after the blast hits and they wake up, they walk a couple steps and they proceed to fall over because their body can't balance. So the ear and blast loading. So the outer ear, the middle ear, and the inner ear are all affected. So the pinna is damaged and burned. The tympanic membrane ruptures and skin cells end up going into the inside of the ear and causes deafness. The cochlea, hair cells are damaged and nerves begin to swell, so information heading to the brainstem cannot be reached, and the labyrinth can no longer send info about movement, balance, and stability to the brain. And the auditory systems, blood vessels, and axons are damaged as well. So dizziness and loss of balance are caused by blast-related TBI. The lungs. Excessive coughing to remove the toxic fumes from the lungs is common. Contusion, inflammation, and edema of the lungs and the bronchioles and the air sacs is very common. And also pulmonary barotrauma, which is excessive pressure changes in the pleural cavity, is common. And blast-related TBI issues can also lead to the development of asthma and COPD. So there are comorbidities with TBI. So sleeping disorders are common because the hormones in the brain cannot be released properly from the pineal gland. PTSD is common as well, but actually the interesting thing is post-traumatic stress disorder and TBI have very, very common symptoms, so they actually get misdiagnosed very often. Depression, anxiety, cognitive impairment are also comorbidities with blast-related TBI. So blast-related TBI and exercise. Balance becomes one of the biggest issues that needs to be addressed because that affects the activities of daily living. Irritability and memory impairments is going to be important, and understanding their actual limits of where they are and how they're doing and all their other treatments for the TBI as well is very, very much important. And hydration, because of the cognitive impairment, is something that needs to watch out for because they may not necessarily understand that they're dehydrated or no. So there's management for blast-related TBI. There's a multidisciplinary team that usually works on cases like this. So they do cognitive therapy, speech therapy, PT, OT, neuro, physicians, and psychology as well. So they can take acetaminophen, opiates, which unfortunately can lead to drug addiction, which we do not talk about in this presentation, and methylphenidate, which has to do with cognitive dysfunction. So I did my case study on Corporal BP. He's a 28-year-old male who served in the Marine Corps for 7 years. He has 2 diagnosed blast-related TBIs within a 2-month period, and he's also diagnosed with post-traumatic stress disorder. His BMI is 24. He has no family history of cardiovascular disease, and if you look at the rest of his risk factors, he has 5, which makes him moderate risk. But because he's not been diagnosed with cardiovascular disease, pulmonary disease, or metabolic syndrome, he's still considered moderate risk and asymptomatic. His goals are core strength and muscular endurance. So for exercise testing, one of the biggest things for him is activities of daily living and getting back to what he was doing normally. So that's why I chose a 6-minute walk test and also sit to stand. Balancing on one foot, we would determine the core strength and what set of exercises to be chosen first. I also chose the chest press over the bench press because the bench press would be too taxing on the cognitive side of the brain. So for the exercise prescription, for cardiovascular fitness, I actually picked the types because the modalities would actually support his body better than anything else, because water is the most forgiving exercise environment. That's why it's used very, very often. So I would have him doing cardiovascular fitness for 3 to 5 days a week at 50 to 75% of his VO2 max, starting at 30 minutes, but I eventually would want to progress him to 60. So resistance training, for this, it's going to be very, very important for me to work with the PT that has been assigned to his case as well as the OT, because I want to make sure that we're all on the same page. So basically, whatever they said, I would go along with. So I would have him doing 3 days a week. 75% of is 5 RM. I would work with machines and physio balls and lightweight and resistance bands. I would also do 3 sets of 15 reps. I would divide it up with upper body, lower body, and core. And for flexibility, I would do after every workout to mild discomfort with static stretching. And do 3 sets of 15 on the major muscle groups. And one of the biggest areas I would focus on is the neck, the shoulders, and the upper back because of the injuries he sustained while he was in the Marine Corps. Balance is also going to be one of the biggest things that needs to be in the exercise prescription because of his ears and his cerebellum and his reticular formation tissue being damaged. So, one of the first things I would start him on is single leg balance. And when he eventually got better at that, I would have him move up to Bosu ball. So he would stand on the blue side and then eventually the black side. And also, because of the TBI, I would have him doing breathing exercises. So I would hope there would be a respiratory care therapist assigned to his case. So what I would do with that is, one of the biggest things with exercise prescription is the Valsalva maneuver and making sure that he does not hold his breath. So if that means we have to lower the weight, I will certainly do so. So in conclusion, blast-related TBI is still being researched because it's not as well understood as other forms of TBI. So currently it's actually being treated similarly to other forms of TBI. And unfortunately, it's underreported in the military community because a lot of times people don't know that they have it, or they don't want to say anything because a lot of times you'll get pulled away from your unit, you'll get put on profile, and you get seen as a lesser service member because you have an issue and you said something about it. And a lot of what's taught is you need to tough it out and suck it up. But with an injury like this, that's not something you can actually do. So if you look in the corner over here, this is actually Corporal BP's service dog. He's had him for about 6 or 7 months. So, Sapper helps him because he knows when BP starts to get upset or angry, and part of the purpose of a service dog is for emotional support, and Sapper's great. So, alright, that's my presentation, everyone.